Welcome back to Mass Appeal. Every 40 seconds, someone suffers a stroke. But do you know the warning signs and symptoms? Joining us now is Angela Smith, the stroke manager from Holyoke Medical Center, and she has tips on how you can prevent strokes and what resources are available for stroke survivors and caretakers. Thank you so much for joining us.
Thank you for having me.
First, I think we should instruct the public a little bit. What exactly is a stroke?
Well, a stroke involves the circulation and the nervous system to the brain. So it's usually a blockage in one of the blood vessels to the brain, or a burst blood vessel to the brain. And what that does, it's the same thing as a heart attack. It just causes tissue damage, and that's when the stroke happens. So it's very simple. If you think of yourself as a house, it's like your plumbing gets either blocked or can burst.
Now, what kind of people are most susceptible to a stroke?
Well, stroke hits across the ages. Now younger people, as young as children, are having strokes, 20-year-olds. The average age really is anywhere between that 60 and 70-year-old age range for stroke.
But anyone can have a stroke now.
Absolutely.
It's kind of gotten larger and larger.
Yeah.
What are some of the warning signs? What might people want to be looking out for?
Well, the type of strokes that people have, it involves the brain, so the symptoms are varied. And the word that usually occurs with stroke is a sudden onset, which means all of a sudden something happens. When the blood vessel blocks, it's like your drain, it just stops. So what happens is you'll have sudden weakness on one side of the body, typically, numbness. You can have inability to speak clearly, your speech is off. You could have problem with vision in one or both eyes. You can also have problems with your gait, walking. You can have a severe headache, like an ice cream headache is typically indicative of a hemorrhagic type stroke, the bleeding type. So it depends on where the stroke is, so it's a little complicated. That's why you need to be able to seek help.
And there's nothing leading up to it, though. It's like that, and you're in the midst of a stroke.
That's right. And usually there's risk factors that are involved that contribute to someone having that stroke.
Well, let's talk about some of those risk factors, because that leads to prevention. If you can not contribute to any of those risk factors, you're more inclined to not have a stroke. So what are they?
Right. So the things that you can't control, obviously, are your age as you get older, family history. But the things that I like to discuss with my patients are the things that you can. You can control your high blood pressure, you can control your cholesterol, your diabetes, you cannot smoke, you can get exercise, things like that that really are the contributors to that lining of the blood vessel that's going to cause the stroke. So that's damage to that lining of the blood vessel, clogs the blood vessel, and predisposes us to stroke.
Now, Angela, let's talk post-stroke. What's the trauma like afterwards, and how do people start recovering?
So when someone comes into the hospital, they immediately, if they arrive within 3 hours, this is really important, you can get a clot buster medication, and I'm going to use it like a liquid plumber. You just give that medication, it opens the blood vessel and it restores the circulation. But after recovery, if you don't get there, or sometimes the recovery is extremely minimal, if you reduce your risk factors and you get to the hospital early, and it'll involve some physical therapy and occupational therapy sometimes it'll involve a rehab stay. But nowadays people are really going home after stroke more than they are going to a rehab center because of early discovery of symptoms.
What are some of the long-term ramifications? Because it's not just that one-time event, it sticks with you for a while.
It does, and it just takes a while for the body to restore its the nervous system to enable things to move again, your arm to move, you're able to speak again. So that's why it's so important for stroke survivors, their caregivers and family to realize that this is something that's devastating, that's affected these people. They are survivors, just like on Monday, these people from Boston, they're survivors. We acknowledge that, we honor that, and it's so important for people to understand that, you know, this is something that they have to take very serious. It's the third leading cause of death and disability.
Well, you are taking it very seriously by the forum that you have upcoming. Tell us a little bit about that and how people can get involved.
Yes, as a nurse, I'm on the planning committee for the American Heart and Stroke Association, and I've been on that committee for several years. This is our 11th year, and this year it's called Moving and Grooving with Stroke. We're going to empower and honor stroke survivors and caregivers. It's on May 8th. It's going to be from 9 to 2. It's only $5 to attend this event. It includes breakfast and lunch. Also validated parking at the Mass Mutual Garage is also going to occur. And there's going to be other hospitals there, nursing facilities, vendors there, educational forums, lectures. We're going to have dance, exercise. Is just going to be letting people feel good about living again.
Well, that's the important part. It's the rebound. You know, you don't want to let one thing get you down. You need to move forward from it and be a better person. And this forum is definitely going to help people accomplish that.
That's right. And I hope as many people that want to attend or learn about stroke and just understand that really the day is to honor these stroke survivors. So it really is paying forward to those people that have gone through this disease.
Angela, I want to thank you so much for joining us today.
Thank you
It is
so
a
much.
difficult disease, so thank you for providing a forum so that people can talk about their experiences. Oftentimes, that's the most important thing, just to be able to have that conversation.
That's right, and keep it positive, too.
Well, thanks for having that conversation with us today.
Thank you.